Ketamine's not a fad. It's not going to go away. There's probably close to 750 clinics across the country, and that number is continuing to grow. I think, about 4 billion in sales or in revenues totals amongst clinics last year, and that's expected to triple by 2030.
Hi, everyone. Thanks for being here. Today, I'm interviewing Dr. Deepak Sharma. He is a board certified anesthesiologist. He has an MD as well as an MBA, and he is the co-founder of 2 ketamine clinics in Scottsdale as well as Gilbert, Arizona. The name of the clinic is Advanced Wellness and Pain, and we'll flash a little website address so you can go ahead and check them out. Hi, Dr. Sharma. Thanks for being here, and I'm really excited to talk to you about all things ketamine and how it is changing some parts of the healthcare industry.
Hi, Sai. Yeah, thanks for having me. And I'm really excited to, educate people more about ketamine. I know psychedelics are definitely on people's minds, but they still don't know that much about the only legal psychedelic in America, and that is ketamine. So happy to answer any questions.
Awesome. So first, before we get started, let's just lay the basics down. What is ketamine, and what are some of the conditions that it's been approved to treat in the United States?
Sure. So ketamine's actually been around. It was FDA approved in 1970. It was initially synthesized in the early 1960s as a alternative to PCP, phencyclidine. PCP was actually being used as an anesthetic in the 50s, but it was quickly discontinued once they found out that people were really delirious afterwards, having hallucinations, and it just had a really long duration of action. So ketamine is actually a derivative of PCP that has a much shorter duration. It was, originally used, in the Vietnam War, actually, in the 1970s. Soldiers were being given ketamine as an analgesic for pain control. And it has very unique properties compared to other anesthetics in that it doesn't cause any respiratory depression. So those soldiers were still able to breathe, and they were still able to walk back to safety if they were needed to be transported by helicopter or to a medic station. So it's had a lot of other use cases throughout the years. It's a lot of people mistakenly think it's just a horse tranquilizer. Certainly it's used in veterinary medicine too, but we use it in emergency situations in the operating room. We use it on pregnant women and children. And there's a lot of medicines pregnant women can't get safely. Ketamine's one of them. And that's why even the WHO, World Health Organization, said it's one of the essential medicines. And because of that, it's essentially can't be illegal. And I think that's how it's gotten through this legal loophole of being the only psychedelic that you can use in America. But it's been used off-label. It's not FDA approved for this. The first study that came out at Yale was in 2000. So over the past, 20 or so years, it's been used at sub-anesthetic doses. So lower than the typical amount that's given for anesthesia or sedation. And it really induces this profound hallucination or psychedelic experience. And that's been really helpful in treating treatment-resistant depression, anxiety, even PTSD. Those are really the top 3 mental health indications. But, there's a lot of ketamine clinics like ours that are also using it for chronic pain. So things that have not been treated well by traditional pain therapies like complex regional pain syndrome, fibromyalgia, even certain types of headaches, neuropathies. So there's really a lot of different uses for ketamine. It's such a versatile drug.
So that's really interesting. I actually didn't know that ketamine was used in a war situation. So that's actually new information for me. So what about the mode of delivery? How is ketamine actually administered? Are there multiple ways to deliver ketamine, or is it IV? Is it inhaled? How does it work?
Yeah, it's a great question. There's actually so many different modalities that are being used. You have some online clinics that are mailing you either an oral ketamine or some people are being prescribed nasal ketamine. that they inhale, but most of the brick and mortar clinics, they either do intramuscular injections, or they'll do intravenous, which is what we're doing, and as anesthesiologists, we're very comfortable with infusing medicines by IV. We're comfortable with, starting IVs. And honestly, if you want to get 100% bioavailability, of the medicines, so you want to get all the ketamine into your bloodstream and affecting the brain, you have to do it IV. And it's the most controlled way to do it. So we really think it's the cream of the crop when it comes to modalities. I can always add on more during the infusion, so it gives me that flexibility to adjust your dose in the middle of the experience, and I can also stop it at any time. And about 5 to 10 minutes after I stop the infusion, most of that psychedelic effect has worn off. So it really is the most controlled way, whereas any other modality, even if you inject it intramuscularly, pretty much, you're on that ride for the rest of that experience. There's no way to really stop it other than, just waiting it out. So that's why a lot of our patients really seem to enjoy it this way.
You alluded to something that I want to dive a little bit deeper on, is that now you can get ketamine mailed to you, you can inhale it. And then you also mentioned how an anesthesiologist in the brick and mortar situation, or in your specific brick and mortar situation, is actually monitoring you. Now, as someone who's never experienced ketamine, I would say that if that was something that I was ever going to want to do or have to do for a medical condition, I would certainly want to be monitored. Talk to me about the safety of different startups that are going into this business that are maybe mailing ketamine. Like, what are the risks involved with not being in-house and monitored, if any?
Yeah, I mean, there's definitely some risk, but like I was saying earlier, ketamine is a very safe medicine in that it's not going to cause respiratory depression, right? People get prescriptions for opioids all the time for chronic pain, and certainly the risk with opioids, and then compounding that with drinking alcohol, which you can get legally. I think there's a lot more risk there, and I think that's why these companies have been able to prescribe these medicines to their patients without really having too many consequences, at least ones that have come out in the news, with the exception of maybe, Matthew Perry recently. And it's a really unfortunate situation with him. But, that's always the issue that I have. And, my partners and I, we've thought about also offering this as a way to kind of cut costs for people that can't afford IV ketamine infusions. But there's a lot to worry about putting this medicine in someone's hands, giving them easy access to it. I think when you consciously have to make that decision, I'm really feeling down, I need to schedule my appointment, I need to arrange a ride for getting an infusion, I need to pay X amount of dollars for this infusion. There's a lot of different things that are kind of keeping you from just using this as a way to escape reality for the moment. Then it's no different than just drinking a bottle of alcohol, and that's what we're really trying to prevent. So yeah, we want people to use it, but use it appropriately. Certainly being in extremes of temperature is not a good idea when you're under the influence of the medicine. But it could just be that he took too much ketamine at that time and got overly sedated. Some people describe it as kind of like going into that K-hole, if you will. So being in a pool of any sort, no matter what the temperature, is just not a good idea. Just like you wouldn't want to drive, operate heavy machinery, while you're under the influence of these medicines. I think, the same sort of skill level comes to be like being able to swim out of a pool for your own safety.
So as an anesthesiologist, you were doing traditional anesthesia at one point, and what inspired you to kind of convert into this part of medicine?
Well, I think for a lot of people, COVID, the pandemic really changed everyone's lives. And for us as anesthesiologists during that time, the country was shut down. Hospitals weren't shut down completely, but only emergency cases were happening. So a lot of elective procedures were canceled, which meant, a lot of us were taking about a 30% haircut, if you will, because that's how anesthesiologists make money, is we need to do more procedures. That's really the unfortunate thing about healthcare in general. It's really driven by doing more procedures rather than actually doing better patient care. But that's just kind of the way it is. And the other thing we were noticing, there's a lot of pressure to reduce labor costs. So a lot of hospital systems are ditching anesthesiology-driven group or anesthesiologist-driven groups for nurse anesthetist-driven groups. They can operate in over 25 states now. So over half the country, they can operate independently. Arizona just became one of them during the pandemic too. So we noticed that trend that there's not as much job security in traditional anesthesia. So we decided, well, instead of relying on surgeons or GI docs or, other proceduralists for work, why don't we create something where people come to us directly? And there were a lot of ideas thrown around. That's how we became Advanced Wellness and Pain. We were dabbling in stem cell injections and things like that. But really the thing that stuck was ketamine. And I think that's because anxiety, depression, all of that skyrocketed because of the pandemic, not just in the US, but globally. Some places or some reports saying that it tripled in the US alone.
Yeah, so that's really interesting because really what COVID did was actually create another opportunity to go into this field. And it's sad, but at least we have places that are treating this kind of, I guess, unmet need. When you're talking about the economics of this, obviously you are running what seems to be a fairly high cost operation because you are, putting IVs in people. These things need to be sterile. I imagine that each patient has their own private room when this is getting done. So when you're talking about costs, is this covered by insurance?
Yeah, unfortunately, it's not covered by insurance. And the thing with insurance is that, we would love to offer that, but then we do have to cut costs, right? With the insurance model, you're chasing after that money for, months, sometimes longer. It requires full-time billing staff, whether you outsource that or you keep it in-house. I mean, the costs are still pretty high. You're looking at, like 8 to 10% of your revenues. So with that model, it kind of forces you to get people in and out the door just so you can actually, make some money. And certainly there's been places that have tried billing insurance, and there's a lot of issues with it. They ended up shutting down, for various reasons. So it seems like a lot of providers nowadays are still doing that cash pay model. And very few providers are running it like us, where it's, high costs, also, higher quality, where you spend more time with the patient. But, it's always been our ethos to run it that way, because it's not just giving the medicine, it's the medicine plus the support, the care, and encouraging the patient to make the most out of the neuroplasticity, that rewiring that they're getting from the ketamine. That's what really gives you long lasting results. Otherwise, it just becomes a revolving door of come back every couple of weeks for your ketamine infusion, and that's not really what we're trying to do here.
So on average, how many cycles do you see people doing before they start to reduce the frequency of their cycles?
So yeah, the standard protocol is 6 infusions over the course of 2 to 3 weeks. So you want to do it minimum of twice a week. You can do that over 3 weeks to get durability from the medicine. And just doing a single infusion, we get asked that a lot. Can I just do one infusion? Yeah, it might make you feel better for a couple of days, but you're not going to get that much out of it. And a lot of people don't get any benefit from it at all. Only 20% of people roughly get a positive response by 3 infusions. And that number jumps up to about 75% across the country, even if you're just giving ketamine by itself without any extra resources and support. But it's even better with long-lasting benefit if you're adding on things like meditation, journaling, gratitude practice, visualization, teaching these people these techniques that they can use to enhance the neuroplasticity on their own without relying on any medicine.
Talk to me about the neuroplasticity. What does that mean, and how is ketamine affecting it?
Sure. So neuroplasticity, in basic terms, just means improving, your brain's ability to learn and adapt to life experiences, especially stressful or traumatic experiences too. So what ketamine is doing, it's very unique. Most traditional medicines and psychiatry are working on the serotonin pathway. Since the 70s, we thought that there was a deficiency in serotonin. People don't have enough serotonin, and that's why they're depressed or anxious. And that may be the case for, the millions of people where those medicines does work, but over 50% of the people that try these medicines don't get any benefit from it, or they just can't deal with the side effects from it. So ketamine, on the other hand, is working on the glutamate pathway in the brain. And essentially it's blocking a receptor called the NMDA receptor, which glutamate normally attaches to. And by doing that, there's now more glutamate to attach to another receptor called the AMPA receptor. And that one gets activated. It starts producing a protein called brain-derived neurotrophic factor, or BDNF. And that's what essentially encourages the brain to start rewiring itself, adding more neural connections. And the brain actually starts, connecting things that normally would never talk to each other. So it essentially makes your brain more efficient. If I had to describe it as an analogy, it's like that shutdown is kind of like the brain kind of rebooting itself, right? When you're anxious or depressed, if you think of your brain as a computer, you have like 100 different tabs open, right, on the browser. And your browser starts running a lot more slowly, right? You're like, man, this computer sucks. So what do you do normally? You just shut it down, start it back up again. Now you've got this clear screen, but you still have this folder on the desktop, and that's all your old behavior patterns, right? And it's very easy to click on that folder and get right into it, back into your old behaviors, because that's what that's what's comfortable. So that's where the resources and support are there. The extra part of our process is trying to help you create a new folder with new habits that actually serve you in the long run.
So you had mentioned 6 sessions for about 70% to feel a difference and notice a difference. For those patients, what is their kind of follow-up after that? Do they come back once a year? Do they not come back? What's been your experience when you've had someone who's fallen into a category after 6 sessions that's really had a positive experience and a positive effect?
Yeah, so the initial stabilization phase that we discussed with the 6 infusions, that's been pretty standardized. But, after that, every patient's journey seems to be pretty unique. So we've had plenty of patients, I'd say about, 20 to 25% that have done the 6 infusions, and they haven't felt the need to come back to the medicine. There's a famous author, I think his name's Alan Watts, from like the 50s and 60s. He once said that, with psychedelics, when you get the message, hang up the phone, right? You don't need to keep, listening, right? It's the same way how a microbiologist will use a microscope to, look at different organisms, right? But they're not going to keep their eyes glued to the microscope all day. They're going to go back to do their work in the real world. And that's what we want to encourage people to do, is get the message that you needed from the psychedelic and then go back to doing your work in the real world. But that doesn't mean that everyone's going to be fixed in 2 to 3 weeks. That's just not reasonable for most people, especially, if these new habits that you're forming are a big change in your identity. It can take you, up to a year to really get those habits to stick. This is why you'll see 1 million people at the gym in January, and then, it's back to the regulars in February and moving on. So we always encourage our patients to get boosters when they need it, as frequently as once every 3 to 4 weeks, but it could be once a year for some people.
So if it's not FDA approved, this is basically off-label use that has scientific support to support the use of it for these mental health conditions.
Absolutely. And, that doesn't mean that it's not safe. The majority of drugs that are used in this country are used in an off-label setting. I can give you an example of Exparel. It's a local anesthetic. It's a liposome enclosed local anesthetic that gives it a lot longer duration of action. It was originally just studied to be approved for hemorrhoid surgeries, but it's used off-label in so many different types of surgeries.
So for anyone watching, the approval usually is linked to a specific diagnosis, and it doesn't mean that the drug itself is not approved for use. It's just not approved for use for this certain indication. And we do see a lot of that in different industries and different parts of medicine where the drug itself is being used for multiple different conditions, and it's only really been approved technically for one. But yeah.
Absolutely, yeah. So, the FDA gives physicians leeway to use these medicines in different ways as long as, they deem that it's safe and effective. And there's 20 plus years of research to back up that ketamine at sub-anesthetic doses has been, really a game changer for depression, anxiety, and PTSD, especially for the people where the traditional medicines don't work.
Hi, everyone. Thanks for watching. If you found this interesting thus far, don't forget to hit the subscribe button below. It not just helps the channel, but it also helps out all the innovators and entrepreneurs that we interview. Thanks for watching. Talk to me about the economics of this. So from the patient's end, how much is a patient spending for 6 sessions?
Yeah, so on average, patients will spend anywhere from $400 to $800 per infusion. We charge $700 per infusion at our clinic. Any less than that, then you really got to wonder, what sort of corners is this clinic cutting in order to make sure the cost is down and that, it's actually sustainable for them to give these infusions. And the other thing you also, want to check into is, who's actually infusing the medicine. There's so many different models. In our model, since we're trying to approach it from high quality, spending more time with the patient, me and my two other partners, both physician partners, we, pride ourselves in directly participating in patient care. But that does mean that our model is more expensive. We can take care of patients, not deal with the bureaucracy of, working with insurance companies to try and collect the money that you deserve. So it really, starts with the insurance companies, just recognizing this as a pretty solid alternative. I personally think it's better than SSRIs, better than the traditional therapies, but I understand that, those pills, it's a lot more cost effective, but for the 50+% of people where it doesn't work, what are you going to do to treat them? You gotta give them this option.
And you're also keeping the patient in-house versus someone who's kind of going on that ketamine journey on their own. And you had mentioned that if someone is with you in the clinic and they're not having a good experience, you can pretty much shut it off.
Yeah, absolutely. And that's really the only way you can do that is by infusing it with the IV. And then on the flip side, there's some people that are getting their infusion saying, not really feeling anything, this is not enough. So that gives us the ability to add on more during the experience rather than waiting for them to have a full experience where they didn't really have anything profound happen and then making adjustments the next time. Whereas, with the oral, with nasal, and even intramuscular, you don't get that much flexibility.
So this is really interesting because we've seen a lot of ketamine clinics opening up in all places around the country. And I'm wondering what your thoughts are on the economic impact of how it might change the drug industry, because of course there's many people that are on antidepressants, on anti-anxiety medication. Do you think this could potentially really significantly reduce that and affect those industries and other industries like mental health therapy and coaching? What are your thoughts on, where ketamine could take these industries in the next decade?
Yeah, certainly. I think, Big Pharma has been looking at ketamine and other psychedelics that are on the horizon, like MDMA, psilocybin, LSD, and they probably perceive it as a threat to, the numerous versions of SSRIs that have been on the market. We've certainly had motivated patients in our clinic who said, "Doc, I don't want to take a pill every day. I don't like how this makes me feel like a zombie. I have all these side effects, dealing with, decrease in libido, sexual impotence, weight gain or weight loss, definitely appetite issues, amongst a laundry list of other things." and they have been able to wean off of it, after being stabilized with ketamine and then coming up with a plan to wean off with periodic boosters of infusions. We've had one of the psychiatrists for my patients called me 6 months later and said, I was able to get off Xanax. And Xanax is one of those medicines that could put, along with other benzodiazepines, that actually blocks the effects of ketamine. And initially we thought it didn't work, because they never came back after those 6 infusions, but it had a delayed effect, and he's able to wean off, and now he's not taking any medicines at all. So certainly it's going to change the landscape of psychiatry. I think for the better. I don't think people want to feel like they have to take a pill every day just to feel good or feel content.
A lot of mental health conditions are now being more recognized. They're actually being treated. And so I think the world is more open to things like ketamine, where I think if you did this a decade ago, people would be in shock that, oh my God, I can't believe you have a clinic where you infuse ketamine for people, because it just seems like, such a dangerous thing to do. So on that sort of subject, because you were talking about side effects, what are the side effects of ketamine? I mean, it can't be all good. There's got to be something that could go wrong with this drug. And I want to know what it is.
Sure, yeah. And really, the major side effects you worry about when someone's getting that higher general anesthetic dose. But at these sub-anesthetic doses where you're getting it slowly infused over the course of the hour, it's really not going to do anything that's extremely alarming. But we worry about patients that have poorly controlled blood pressure, issues with their heart, maybe irregular heartbeats or arrhythmias, recent heart attacks, or maybe heart failure or something like that. Also, we want to make sure that they're relatively healthy. Even though ketamine has actually been used to treat status epilepticus in the ICU, it's classically been known as a medicine that can potentially, lower that seizure threshold, more likely to have a seizure. So we try to avoid patients that have a seizure history. Certainly, patients that have psychosis, history of schizophrenia, ketamine being a hallucinogen, and we're actually inducing psychosis, if you will. You want to be careful or cautious with these patients. But that said, we've had patients, with that history or have had hallucinations in the past, and they've still done really well with the medicine. So, everything is kind of relative. I don't know if there's, truly any, absolute contraindications with ketamine. And really the most common side effects people worry about are nausea, headache, and then the fact that ketamine is a pretty strong diuretic. So having that urge to go to the bathroom during the experience can kind of take away from the experience. But really, we have medicines to help mitigate all of those risks. So it's not just ketamine that you're getting with the infusion, it's ketamine plus these extra medicines, things like Zofran or magnesium and whatnot, to help with those side effects.
So I see that that's kind of one of the benefits also to coming in, is that you can have access to something like Zofran, which is an anti-nausea medication. And do you typically deliver that IV if someone's experiencing that during the...
Absolutely. And that's the other beauty of IV, is that, we can give all these other medicines quickly. You can give Zofran orally, and I imagine the intramuscular clinics are doing it that way. But yeah, everything we do is through the IV.
Another question I had, because you had mentioned this earlier. So you did say takes disposable income to get one of these treatments. And of course, we know that not everyone with anxiety, PTSD, depression has that kind of disposable income. It's a very significant amount of money. How do you see this industry sort of being able to treat those patients, hopefully moving forward? Like, what do you envision a solution is to kind of be able to be more inclusive with a population that also needs it?
Yeah, so I really think, insurance companies really need to stop playing games. They do all these things to kind of basically deny paying for these kinds of therapies. And it just really makes it difficult for us providers to just provide patient care. All of us got into this field so that we can take care of patients, not deal with the bureaucracy of, working with insurance companies to try and collect the money that you deserve. So it really, starts with the insurance companies, just recognizing this as a pretty solid alternative. I personally think it's better than SSRIs, better than the traditional therapies, but I understand that, those pills, it's a lot more cost effective, but for the 50+% of people where it doesn't work, what are you going to do to treat them? You gotta give them this option.
Well, it's more cost effective in the short term. If we see people actually being able to get off of their medication for years, it might be more cost effective from a long-term perspective. I don't know. Your thoughts on that?
Yeah, I mean, I don't think people really think long term, unfortunately. I totally agree with you that, if we're able to get people off their medications, you don't have to take ketamine forever either. And now people feel motivated to heal themselves daily. A lot of people feel empowered. They didn't realize that they had it in them all along to feel good. It really changed their perspective on life. So yeah, it could certainly uh, in the long run decrease costs, but everyone's just looking at that upfront. Oh my God, this is thousands of dollars, and even the insurance companies looking at it that way, unfortunately.
Another point that I just want to highlight before we sort of wrap up is that you mentioned the cost of even running a business with insurance, and I have to agree with you because I would say that 50% of my staff's day and maybe about 5 to 10% of my day is spent verifying insurance, or if I want to refer someone to another doctor, I need to make sure that that doctor is in network with their insurance. And we try not to put a lot of the onus on the patient. I'm technically the patient should be looking that up, but when patients are in a tough situation, like we as doctors in our office, we really want to do as much as we can to help facilitate that. So we do a lot of that. And things, it's literally really hard to keep up with not just who takes what, but also what drugs are covered, and should I be giving this coupon to get this drug covered? And it's a lot more of my day than I anticipated it being, where I'll prescribe something to a patient because that's the therapy that they need. And then they come back a week later saying, no, I didn't take it because it was $350. My insurance isn't covering it. Then we fill out a pre-authorization form, and then that gets rejected. And then we're back to the generic drug that wasn't working for them to begin with, which is really interesting because ultimately these insurance companies are going to have to pay for more expensive therapies down the line when this patient is not being given some of the first line therapies that could actually cause long-term better results. So that's probably a whole other discussion, but definitely agree with you there on just some of the barriers that a lot of physicians face when they're trying to treat patients to the best of their ability, is that there's a lot of barriers to care that are unfortunately just not in our control. I really
One other thing I didn't mention is one of the games that insurance companies play that patients are probably unaware of is they do these clawbacks. They'll initially pay for this treatment, and then sometimes years down the road, they'll try to claw back that money saying, oh, we actually overpaid you, or actually, we shouldn't have paid you at all, so we want this money back. How is any healthcare company supposed to reasonably operate if at any point we get paid and then all of a sudden years down the road that money needs to be paid back? It's just not fair. Insurance companies just get away with way too much these days. They have so much power in this industry.
Yeah, it's definitely a huge barrier for a lot of us that are practicing to just deliver the best care possible, and then spend a lot of our day dealing with what's covered, what's not covered, what can I actually prescribe. And then the downside of that, like you mentioned, is if I want to hire more staff to go and verify insurance, guess what? That means I need to see 2 more patients per hour to cover that overhead, versus being able to actually just see the amount of patients that's comfortable and normal, rather than, okay, well, now I hired an extra person because we have to deal with pre-authorizations. We have to deal with, paperwork, and we have to deal with calling insurance to get things verified and get approval for the visits. And that directly translates into there being more volume in the clinic to keep the clinic's lights on. So it's it's become an interesting race that I don't see stopping anytime soon because the cuts are just getting worse in medicine, unfortunately, and the reimbursements are just getting worse. And I do see a lot of people going to a direct model where they're just, dealing with the patient themselves and they don't have to have, an entire staff just dedicated to focusing on how you get money from the insurance company.
Absolutely. And, I wanted to also mention that we do provide super bills to our patients. So yes, we are putting the onus on the patient to, interact with their insurance company and see if they could potentially get some reimbursement. Uh, Patients can get anywhere from 20, sometimes up to 60% reimbursed, never, the full amount. And most will just flat out get rejected or denied. But the other problem with that is on the super bill, there really isn't an infusion or there isn't a proper procedure code for what we're doing here. We're billing an infusion code, the 96365. It's just that's like a standard infusion over the course of an hour. So, I really think if they came up with some adequate procedure codes where the reimbursement's a little bit stronger, that could really help a lot of patients out.
Do you see efforts in this area of lobbying and trying to get the proper procedure codes? Because as we know, in order to get something approved, it has to go through the process of actually having the proper code associated with it.
Yeah, and I think there's definitely efforts out there. How far they've gone, it's tough to say, but really both sides of the aisle, Democrat and Republican, I think are on board with the psychedelics.
Thanks so much for being here, Dr. Sharma. It's been super interesting. I've learned a lot. I had a lot of questions about ketamine, and you really answered a lot of them. I want to know, what do you see in the future of psychedelics as a medical therapy?
Sure. Well, for one, ketamine's not a fad. It's not going to go away. There's probably close to 750 clinics across the country, and that number is continuing to grow. I think, about 4 billion in sales or in revenues totals amongst clinics last year, and that's expected to triple by 2030. And I think it's because anxiety, depression, the prevalence of it is continuing to increase, especially with all this stimulation we're getting from, social media, being glued to our phones, things like that. And because of that, there's going to be a need for, other options. And thanks to the work of Rick Doblin and MAPS, amongst, so many other people, MAPS being the Multidisciplinary Association for Psychedelic Studies, they've now just submitted a new drug application in December of last year for MDMA for being used for PTSD, and I imagine other indications soon to follow, depression, anxiety as well. And then on the horizon, there will be psilocybin, a lot of work being done at the major academic institutions like Johns Hopkins for how psilocybin benefits people for similar indications, LSD, DMT. There's a lot of opportunity here. Yeah, so I don't think psychedelics are going away. People are waking up to the fact that they're not just, ketamine is not just a club drug, or it's not, a drug of abuse or anything. It's a tool, and it's a tool that can be used to help you heal from trauma, help you get unstuck from those repetitive negative thought loops that you have in your head, and get unstuck from that negative self-talk, the one that says like, oh, I'm an idiot, or I can't do anything right, or I'm not worthy of success, I'm not worthy of happiness. It's really been life-changing for so many people. And I think traditional antidepressants have fallen short, so it's time to move on.
Thanks so much for being here. Really interesting conversation. I'd love to do a follow-up with you in about a year to see where this industry is at.
Absolutely. And I'm sure a lot will have changed by then. So excited to chat with you. Thanks again for having me today. For anyone that's interested or in the Arizona area, please look us up at advancedwellnessandpain.com. Especially, if you're struggling with any of the above, anxiety, depression, PTSD, or even some of those chronic pain syndromes that I mentioned too.